Hi, I'm Dr. Sri Banerjee, and in this video, I will be going over a little bit about how to be thinking in terms of Healthy People 2030. I've called this lecture Healthy People 2030 Intuition. And the reason I've called it this is because intuition is something of an art as much as it is a science. So you have to get a sense of what the objectives are. In summary, there are 355 objectives, and these are some goals that working groups have tirelessly worked for years to come up with. And these are goals that policymakers and public health practitioners can aim for while they're creating interventions. So there are actually achievable objectives that I'll be going over today, and really some intuitive topics, broad intuitive topics that the objectives have been divided into. So buckle up, folks, as we take a journey through some of these topics. So in this website that I have clicked on, there are objectives that have been divided into five broad categories. And those five categories are health conditions, health behaviors, populations, settings and systems, and yes, social determinants of health, which are extremely important, especially in the context of understanding how these may impact overall health within communities. And there are five objectives within the social determinants of health, five broad topics that these have been explored further in. However, within this video, we're focusing more on the general topic. So if we go down and take addiction, for example, then we see that there are actually the goal is reduce drug and alcohol addiction, which is in blue. And then if you scroll down, there's a broad description of what this is. So there is for instance, 20 million people in the United States have a substance use disorder. And then on the right, if you pay attention to this panel, there's five baseline objective. So there's five baseline objectives, objective status checks that are provided. However, there's not any additional information that is provided. So if you scroll down in this page, you can see additional addiction related objectives that have been provided here. And so all of these, there's only baseline data provided, as you can see to the right. This first one, increase the proportion of people with a substance use disorder who got treatment in the past year. So we're looking to increase treatment levels. So if we look at browsing objectives, you can go in to any topic or subtopic. For instance, cancer. You can even go into dementia or infectious diseases. So there are a lot of different health conditions that you can explore further. And then if you go and look, there are health behaviors that are really important to be considering. And of course, vaccination efforts are always at the forefront because whether it's childhood vaccinations or vaccinations for influenza or something related to a pandemic, then you always are looking to increase those rates. So, as I described within the addiction example, there are some general type of guidelines. For instance, the description reads, children and infants need to get immunized against hepatitis. And of course, there's the hepatitis B specific vaccines and the immunization schedule that are so important to follow throughout your childhood's your child's life and throughout the major milestones, the developmental milestones. Most children get recommended vaccines, and some U.S. communities actually have very low vaccination coverage. And so, therefore, outbreaks and things are more frequent in these areas. So, very important to be aware of this. And when you're creating community level interventions, it's important to be aware. So there's 10 baseline objectives, and so you can kind of go over these here. Then, if we go over to the next set of topics, intuitive topics, we went over health conditions, we went over health behaviors. Now we can look at populations. And now this is important because, for instance, when I attended the American College of Epidemiology conference this year, one of the major uh, speakers, and Dr. Greg Poland actually stated that grouped analysis is extremely important to consider, especially when we're thinking about trials and clinical trials and vaccination efforts. He was speaking in the context of COVID in that talk, but it is also important to conduct analyses, epidemiological analyses, and understand what are specific concerns in populations. And so here in this Healthy People 2030 guide, there are several areas where there needs to be more of a focus. So in adolescent health, there are several that are improving, as we can see on the right. But five that there have been no change, and nine, alarmingly, are actually getting worse, nine objectives. So this is something that really needs to be further explored. Interventions need to be created in this area. And you can kind of see the areas where there are little or no change. And I can highlight, for instance, there's an increase in the proportion of children and adolescents who communicate positively with their parents. So there's actually so this is getting worse. So there's not as much communication, or the communication is not as well as it should be. So there needs to be more work done. And so you can explore further what is getting worse, what the most recent data is. So the most recent data shows that 65.3%, the target was 73%. So there's an increase desired. And initially, when this was measured, there was good communication among 68.5%. So this actually did get worse. And when you have positive communication, then you have healthy behaviors and then better health outcomes as well. So this is something that is getting worse and really does need attention. So now if we look further down, we have already explored health conditions, then health behaviors, populations, and then settings and systems. So this is extremely important if we're looking at the community versus environmental health, versus global health. So the context of what the population setting is extremely important. So if we look at global health, then we're looking at some developmental objectives, and how global health is connected to us domestically, and how to prevent and detect actual public health threats. So the emergency preparedness has a lot of global health objectives as well. But you can kind of go through this and see what these are informing on a broad level, and then go from there. So the next broad sort of topic is the social determinants of health, as I mentioned already. And of course, there's five areas: economic stability, education access and quality, health care access and quality, neighborhood and built environment, and social and community context. All very important, crucial areas that need emphasis and focus. And I will be going over this in a separate video about what are the important points to focus on. So if you can take a look at that video, and also on your own time, click through each of these links. I hope you've learned how to effectively use the intuitive topics feature in the Healthy People 2030 objectives. Thank you for listening.